Hi, my name is Christy Rivera, and I am going to be performing some skill sets for my PN nursing class. These are going to be peer-reviewed by Justin Smith. We're going to start by washing our hands. Going to turn the water on. Make sure it's nice and warm. We're going to wet our hands. We're going to make sure that our body doesn't come into any contact with the sink. We're going to get a couple of pumps of soap. We're going to begin washing by rubbing our hands together, getting a nice lather. You want to wash your wrists, get in between your fingers. You want to do your cuticles. You want to do this for about 2 minutes. If you want a more in-depth discussion about hand washing, please see video skills number 1 of this series. You want to get underneath your fingernails. Rinse your hands. Before you shut the water off, you want to dry your hands first. You want to pat them, not rub. Make sure you dry in between your fingers, especially if you're going to be wearing gloves. Throw that away. Grab a new barrier to shut your water off. Throw that away. The next skill we're going to be doing is donning sterile gloves. So we are going to get our sterile gloves and open the pack. You have 1 inch around the gloves to work with. So you will open your gloves like so. You will use your dominant hand. You will put the glove on your dominant hand first. I'm right-handed, so I'm going to use my left hand to pick up the gloves. And I'm going to pull. Okay. Next, I'm going to take 2 to 3 fingers and go underneath the cuff of the other glove. And I am going to pull that glove on. Okay. Now, because you have 2 sterile gloves on, you can fit your gloves to make sure that they are on correctly. And that is putting on sterile gloves. To take your sterile gloves off, you want to pinch in the middle, or any gloves really. You pinch in the middle, you pull it off your one hand, then you take your thumb and you go under the other glove and you kind of scoop that glove in there and you can throw them away. Next thing we're going to do is make a sterile field. So we're going to take our sterile dressing tray, we're going to open that, and inside there'll be a red bag on top. You'll remove the red bag. You want to grab your sterile dressing by the corner and lift up. You can shake it out just a little to grab the corner. You have 2 inches to work with here, and you'll want to lay that down. Okay. So, this is your sterile field. Now what we're going to do is draw up medications. So, we are going to put on a regular pair of gloves for this. No need to be sterile right now. So, I'm going to glove up. I have all my supplies ready, and I have my doctor's orders. And the doctor's orders are for morphine and for ceftriaxone. So the order, when calculated, we have 0.7 milliliters of morphine that we need to give, and we have 1/2 milliliter of ceftriaxone. We're going to get our alcohol pad, get all of our stuff here, and we're going to wipe the tops of the bottles. And while those are drying, we're going to get our needle ready. So the first medication we're going to draw up is the morphine, which is 0.7 milliliters we want. So we are going to get our needle, get our morphine. Now, we want to pull back on the plunger 0.7, which is a little bit below the half mark of air, and we want to put that into the bottle so that we have a good suction. Now we want to draw out the amount that the doctor has requested for the patient. Now you're going to want to get any air bubbles out. So once you draw up your 0.7, you'll want to do a couple of quick flicks to make sure all bubbles are removed. And that is 0.7. Now, in a real hospital or medical environment, we would not be using the same needle. However, for practice purposes, we are going to use the same needle. And I am just going to put this medication back in there. Okay. You want to passive cap your needle. I'm going to put that back in there. Okay, now we are going to draw up our ceftriaxone, and the doctor has asked for 1/2 milliliter of that. So we are going to get our clean needle, clean syringe. We're going to draw about 1/2 milliliter of water in there. Air, I apologize, not water, air. Remove your cap, put it in your medication bottle, and inject the air. Now you'll want to draw 1/2 milliliter of your medication in there. Again, you'll want to make sure that you have no air bubbles in there. And the 1/2 milliliter is 0.5. And there you go. And again, we would not be injecting medications back in the bottles. We would obviously be using them. And we would not use the same needle. So I'm going to passively cap that. Put that back in there for future use for students. And that is drawing medication. And again, you can take your gloves off. I apologize. Before you take your gloves off, when in a real setting, medical setting, hospital setting, you'll want to take your needle once done, and you'll want to put it in your sharps container. Okay, and those are my skills.